Okay, let's talk about something that affects a huge number of pregnancies: insomnia. The big question has always been, are the most common sleep aids, these Z drugs, safe for the developing baby? Well, a really important new study just published in JAMA Psychiatry gives us the clearest answer we've had to date.
And really, this gets to the heart of a major clinical dilemma. On one hand, you have a pregnant person who desperately needs sleep. On the other, there's always the concern about potential risks to the fetus from any medication. This is exactly the problem this new research set out to solve. So, let's just lay out the stakes here. We're not just talking about being tired. For over 40% of pregnant individuals who experience insomnia, poor sleep is tied to some pretty serious risks, like preeclampsia and gestational diabetes. Now, Z drugs like zolpidem are often prescribed and they work, but we know they cross the placenta. The real issue has been that all the safety data we've had so far comes from small studies, which left a huge question mark for both doctors and patients.
All right, so let's get straight to the bottom line. What was the main takeaway from this huge study? This is the core finding that really speaks to the biggest concern.
And the answer is incredibly clear. Look at these numbers. After the researchers adjusted for all sorts of other factors, age, health conditions, you name it, the relative risk for congenital malformations in the group exposed to a Z drug was 1.01. To put that in perspective, the baseline risk in the unexposed group is 1.00. That's virtually no difference at all. It's statistically the same.
And here it is in the researchers' own words. This is the top-line conclusion directly from the paper. I mean, this single sentence is really the most important message from this entire study.
So, a finding this definitive begs the question, how did they do it? What makes this study so powerful and so different from what came before?
Well, the first part of the answer is just the sheer scale. We're talking about an analysis of 4.3 million pregnancies. That is a massive number. It gives the findings a kind of statistical weight that just blows past anything we've seen on this topic before.
And it wasn't just about size. The method here was top-notch. They used data from two huge U.S. insurance databases, Medicaid and MarketScan. But the real key was how they compared the groups. They used a sophisticated statistical method called propensity score weighting. You can think of it as a very clever way to make sure you're comparing apples to apples. It allowed them to control for dozens of other factors, to really isolate the effect of the Z drug from everything else.
It's also worth noting which specific medications we're talking about. As you can see, the vast majority of cases, over 92%, involved zolpidem. That's not too surprising, since it's the most commonly prescribed Z drug out there, so the findings are most relevant to it.
Okay, so the main finding is reassuring, but that's not the whole story. To really understand what the researchers found, we need to dig a little deeper into the data.
This table gives us a breakdown by major organ systems. And again, you can see the same pattern. Whether we're looking at cardiac, gastrointestinal, or central nervous system malformations, the relative risk numbers are all very close to 1. But the really important thing to look at here is the confidence interval column. Think of that as the range of uncertainty. And for every single one of these categories, that range includes the number 1.0. In statistics, that's a key sign that the result isn't statistically significant.
But the researchers were thorough. They didn't just look at broad categories, they also drilled down to look at some very specific and much rarer birth defects, ones that have been hinted at as possible concerns in previous, smaller studies.
And this is where things get a bit more nuanced. They did find what they describe as weak signals. As you can see, the relative risk numbers for a few very rare conditions like neural tube defects were a little higher. But, and this is a really big but, the context here is absolutely critical.
So why do they call these signals weak? Well, for two main reasons. First, they were statistically imprecise, which basically means there's a wide margin of error around that number. And second, and this is really important, these signals weren't consistent. They might pop up in one database but not the other. When you can't replicate a finding like that, it makes you wonder if it's a real biological effect or maybe just a statistical fluke.
And this really helps put it all into perspective. Let's just say, for the sake of argument, that the signal for neural tube defects was real. What would that actually mean? Well, the absolute risk increase is incredibly small. We're talking about maybe one extra case for every 4,200 pregnancies exposed to a Z drug. So even in a worst-case scenario, the magnitude of the risk is very, very low. Okay, so after all that data, what's the take-home message? How should doctors and patients actually use this information?
It really comes down to three main points. The first, and maybe most important, is reassurance. For anyone who took a Z drug before they realized they were pregnant, this study provides a lot of comfort. The second is about making an informed choice.
This data gives doctors and patients a much better foundation for that risk-benefit conversation when insomnia is severe. And finally, the third point is ongoing watchfulness. The overall message is reassuring, for sure, but those weak signals for very rare defects are a reminder that it's still wise to be vigilant.
So in the end, this landmark research isn't just a simple yes or no answer. What it does is far more important. It takes a huge area of uncertainty and replaces it with solid, large-scale evidence. And that allows for much better, more informed conversations between patients and their doctors about how to best manage a really challenging condition during pregnancy.